Good morning, good afternoon, and good evening, everyone. I welcome you all to the 1794th day of uninterrupted IFPH webinar. And our today's guest is Dr. Poonam Chablani, and she is having 30 years of clinical experience, Director Homeopathic Cardiologist of India. She is being a part of many cardiology camps with HCFI, where patients were prescribed with homeopathic medicine and having notable outcomes and results. Organized many camps with Rotary and Lions associations, executive member of NHMC alumni, life member of SDHA, IIHP, HMAI, KHA, and volunteer. She is a speaker in many homeopathic conferences in online and offline mode, and she is a winner of many awards. She had written articles in leading newspapers, Hindustan Times, and Mail Today. And now she is here to present on the topic of understanding science and art of gut health. I welcome you, Dr. Poonam Chablani. Doctor, you can start your session. You can take up to 45 to 50 minutes for your session. You please allot last 10 minutes for discussion.
Okay, thank you. Thank you, Dr. Shweta. Is my voice audible?
Yes, Doctor, it is audible.
Thank you. First of all, I would like to thank the organizers of IFPH, especially Dr. Mridul Sani sir, Dr. Danesh sir, and my moderator, Dr. Shweta, and the participants for giving me this opportunity and coming today for this lecture. IFPH is regularly organizing CME and lectures on the daily basis on this platform in different languages, in Hindi, English, and Malayalam. And it is very informative and very knowledgeable for all of us. Earlier also, I have come on this platform and I have covered many health topics like mental health, brain health, liver health, and gut health. And today also, I will be covering a very, very important topic of gut health. The topic's name is Understanding the Science and Art of Gut Health. Can I share my slide?
It is visible.
Yeah. Today's topic is Understanding Science and Art of the Gut Health. I am Dr. Poonam Chablani from Delhi. I have done my BHMS from NHMC, Delhi. I've done my PG NIHFW, PG Diploma Mental Health, NDDY. I'm a Reiki Grandmaster, and I started my career with Dr. Jugal Kishore's clinic. As we start with every topic with a disclaimer, today's presentation at IFPH Talk is on the topic Understanding Science and Art of the Gut Health. It's only for the educational purpose on this platform, on this public platform. And you are not intended to diagnose or treat the disease. Definitely, you will be benefited from it. Today's agenda will be divided in 7 parts. First will be the science of gut health, as the name suggests. We'll be discussing in it the microbiome, its functions, gut-brain axis, modern lifestyle leading to the dysbiosis and leaky gut, leading to diseases and the signs and symptoms of it. Then we will discuss the microbiota in health, in disease, in old age, and changes in different age groups. Second, we will discuss about the art of gut health. We will discuss personalized nutrition, lifestyle modifications in it, mindful eating, stress management, gut-friendly cooking. We'll talk about probiotics, prebiotics, psychobiotics, symbiotics, and holistic approach of treatment. Thirdly, we will discuss bridging science and art with practical steps and case studies. Fourth, we'll talk about the emerging trends using science and art in the management of chronic diseases. Then fifth, we will discuss about the challenges and opportunities. Sixth is the homeopathy and gut health. And seventh will be summarizing it. The science part, the science of the gut health, it includes the microbiome. As you can all see in the diagram, this diagram is from PSM. The disease cannot occur alone. It needs three elements. The host should be there, microbiota or microorganism should be there, and thirdly, the environment is the most important. If any one of this is missing, disease will not occur. The human being is of three elements: the host, microbiota, environment. Then only the disease can happen if the environment is poor or if we have lifestyle problems. Humans have symbiotic relation, that is a good relationship with the good microbes and host. It is said that all health starts in the gut. Your gut is the doorway or the gateway of health. The energy, memory, and the chronic diseases are all linked to the gut health. Your gut microbiota is unrecognized, less talked, less discussed. It is a regulator of both your digestion and the whole body health. Not only the digestion, but it takes care of the whole body and many, many other things also. And it plays a very important part. Today's lecture, the purpose of the lecture is to understand and simplify the science, to optimize your microbiome health, and for amazing energy, brain health, disease prevention, and longevity. It is seen that when we are born, we are in the womb of the mother. A fetus is made up of trillions of microorganisms. Many bacteria, virus, fungi, and the genetic material all are there in the womb. And when we are born, we carry it with us. These microorganisms are there in all the organs, from mouth to anus, and it is highest in the gut colon. And these are good bacteria. They are protecting and taking care of your immunity and lot of other functions. If you want to remember, your gut is from mouth to anus. You can remember moss in LA. Mouth is M, O is esophagus, S is stomach, S is small intestine, moss. In L is large intestine, A is anus. So it is not only stomach, it is the whole mouth to anus comprises of the gut. And the microorganism is maximum in the gut colon. They are of different species, different quality, different quantity, various diverse functions. We are more bacteria than the human cells. Trillions of bacteria. Human cells are not that much. We are more bacteria. And all these are mostly friends and they are working 24/7. You can see in this slide, what is gut health? It's a balance between a good bacteria and the bad bacteria. The good bacteria comprises of 85% and the rest 15% is the bad bacteria. If there is any imbalance, dysbiosis happens, disease happens, and just see how many bacteria are there in the gut. It's 1 kilo of bacteria every human carries in the gut. What are the factors that affect the gut? The lifestyle factors. If you're not maintaining your lifestyle properly, too much of stress, lack of proper sleep, improper nutrition, regular use of antibiotics, antacids, and high intake of sugar. You are not taking care of your health, it will affect your gut health. The functions of gut microbiota. There are three main functions that you can remember easily with the name number is DIM. D is for digestion, I is for immunity, and M is for metabolic functions and the moods. First function is the digestion, absorption of the nutrients, synthesis of the vitamin 12, B12, and vitamin K is in the gut. The bowel movements, taking care of your constipation and diarrhea. Then metabolism, carbohydrate metabolism, protein metabolism, fat metabolism, all is there in the gut. And detoxification, taking away of the toxins from your body, making you feel healthy. Second is the immunity. You will be surprised to know that 85% of the immunity is in the gut. That gives you the defense mechanism. Your gut is a tolerant organ, will tolerate everything. Whatever you take care of it, you will not take care of it, it will take time to get disrupted. So your gut axis is there. Third function is M, is the metabolic function. Mood swings, mood or the gut-brain axis. In the next slide, we see also that your brain is the first brain, your gut is the second brain. If something happens to the brain, your gut is affected. If something happens to the gut, your brain is affected. There is two-dimensional communication. Both are interdependent, and the gut is second brain because it produces neurotransmitters. They are produced in the brain also, but secondly, they are produced in the gut. And 90% neurotransmitters are in the gut. For example, serotonin, it takes care of depression. Dopamine, GABA, acetylcholine, norepinephrine, all these are neurotransmitters. You can see this diagram, the gut-brain axis. The brain and the gut are linked together. We saw the communication. The brain communicates with the gut through the vagus nerve. And if there is any gut microbiota dysbiosis, the balance of the bacteria is disrupted, it will lead to many diseases. It will lead to stress, psychiatric disorders, neurodegenerative disorders, and obesity. In the other diagram, you can see the gut-brain axis. The brain controls the gut motility, enzyme secretion, microbial balance, pain sensing. It is affected by your stress and behavior. And again, this is through the vagus nerve. And the gut communicates with the brain through the neurotransmitters. It produces hormones, neuroimmune. The neurotransmitters influence your mood, emotions, anxiety, hunger, behavior. So it plays a very important role. Then we'll discuss microbiota and health and disease. Disease makes, we say it, dysbiosis. In the diagram, you can see in the healthy gut microbiota takes care of your metabolic, oxidative, and cognitive status. There is a hemostasis. There is a balance between the both bacteria, good and bad. Therefore, it is a healthy gut microbiota. Due to any reason, if there is imbalance of the gut microbiota, it leads to the dysbiosis, leading to the increased intestinal permeability, that is leaky gut. Toxins pass in the blood, causing inflammation to the organs and chronic diseases. But it can be corrected through diet, through supplements, through exercise. And therefore, this portion is reversible here. The gut health impacts every system of the body. You can see there is imbalance. The bad bacteria is more, good bacteria is less, causing inflammation to all the organs, to your bowels, inflammatory bowel disease, Crohn's disease, ulcerative colitis, liver disease, causing cirrhosis and hepatitis, chronic kidney disease, brain disorders, Parkinson disease, Alzheimer disease, and depression. It leads to diabetes, type 1, type 2, gestational also. Then it affects the lungs, causing asthma, bronchitis. It causes cancer, lung cancer, colorectal cancer, pancreatic cancer, oral cancer. It is related to the heart disease, hypertension, and atherosclerosis. So all this is itis, inflammation. The next slide says the modern way of living. The modern way of living we see is that when you are not taking care of yourself, your lifestyle is irregular, You are eating at night, you are waking at night, you're not sleeping in the proper time, you're not taking care of your health. Lifestyle is changed because of the call center jobs, tough jobs, demanding jobs, whatever you say. And everybody, even in the schools, there is a stress. So you have to handle this properly. If you're not taking it care of the lifestyle, it will lead to dysbiosis, to leaky gut, and to the modern chronic diseases because of the inflammatory thing. Then the factors that affect this is the mode of delivery. The vaginal delivery is preferred because of the microorganisms protect the baby. Birth environment should be the hospital is first preference. Then food and life habits are important. Then xenobiotics. Xenobiotics are the chemical and or the natural things, things that take care, that are present there, and they are in high concentration, causing harm to your body. For example, it can be drugs, pesticides, cosmetics, plastic, heavy metal, food additives, industrial chemicals, and all, even because of the air pollution, you can say. All this contribute to the xenobiotics. It's a foreign substance that is harming you. So all this is step by step. In the chart, you can see the 1950 and 2000, there is more progress of the chronic diseases, multiple sclerosis, type 1 diabetes, and asthma in 2000. What are the signs and symptoms of the gut dysbiosis? It can be from the simple acid reflux to a complex thing. Acidity, loss of appetite, swallowing trouble, discomfort after the meal, feeling of fullness, abdominal cramps, bloating, brain fog, discomfort, pain before or after passing stool, excessive gas, belching, flatulence, constipation or diarrhea, nausea, vomiting, blood abnormalities, high blood pressure, obesity. You can see in the next slide microbiota dysbiosis in different age groups, from the pregnancy, infancy, toddler, adulthood to the old age. What affects the microbiota? During pregnancy, if the maternal diet is low in fiber diet and rich in sugar, it will affect the mother and the baby. In infancy, if there is no breast milk given to the child, it will affect the child. Preterm birth, premature delivery, and C-section, because microorganisms protect the child, and in C-section, it will not protect. Then comes the infancy. There can be allergies, type 1 diabetes, infections. So you can give in infancy, in toddlerhood, in adulthood, there can be exposure of antibiotics, too much exposure of antibiotics that affect the microbiota. Then there can be inappropriate nutrition, physical decline in the old age. Then in other age groups, there can be stress, lot of medication can be there. All these things affect the microbiota. In infancy, it can cause allergy, type 1 diabetes. In adulthood, you can see IBD, inflammatory bowel disease. In old age, you can see with the memory loss, Alzheimer disease. Then how your age impacts your gut health? In main 3 points. You can see the healthy gut and the damaged gut. There is shift in microbiome because of high fat, carbohydrates, nitrates, antibiotics, sulfate, stress, and exercise. It damages gut. All these factors damage the microbiota, and it increases bad bacteria, reduces good bacteria, causing cancer, cardiovascular disease, and brain disorders. These good bacteria are bifidobacteria population, and that is responsible for the healthy gut, vitamins, immune system, and everything. And the bad bacteria that rises causes rises and causes many infections like SIBO and SIFO. Like small intestine bacterial overgrowth will be there and small intestine fungal overgrowth will be there. So first is microbial shift. Second is the changes in the gut barrier function. The pores will become more broader and toxins will pass, causing a leaky gut. And third will be the inflammaging, that is causing chronic systemic inflammation, leading to chronic diseases. In short, summarizing the microbiota, the gut dysbiosis with aging, the contributing factors are for the dysbiosis are high fat diet, malnutrition, physical inactivity, altered gut morphology, recurrent infections, repeated hospitalization, and antibiotic usage, leading to the health risk because of age-associated microbiome dysbiosis. There is reduction in short-chain fatty acids, reduction in microbial species, reduction in bile acids, increase in intestinal permeability, and their OMVs is also increased. There is leading to health risk. In health risk, what can be there? GI infections, muscle atrophy, cardiovascular disease, and neurodegeneration, and increasing inflammation that will cause systemic inflammation of all the organs, leading to morbidity and mortality. There will be more death and more infections. And what is the treatment of it? Interventions can be done. The treatment part can be prebiotic, probiotics. Then latest thing is fecal microbiota transplantation, FMT, and microbiome enhancing lifestyle changes. In this one slide, we have covered all the things, the contributing factors, health risk and interventions, everything in pathology. Coming to the second part, art of the gut health. This one slide speaks everything. The art of the gut health, we are talking about the personalized intervention. No two people are same. So how can the diet and everything be same for everybody? So you have to do a personalized intervention, a tailor-made intervention for each and every person in detail by three things: diet, supplement, and exercise. You can take care of the microbiota, preferably Mediterranean diet, and our Indian diet is also equally very good. Supplements, we will talk about the probiotics, prebiotics, omega-3 fatty acids, symbiotics, combination of pre and probiotics. Then psychobiotics are the probiotics that are mood enhancers, improve mood. Then antioxidants like seeds, flax seeds, chia seeds, and everything we'll talk further also. Then the third part is, third pillar is exercise. It should be minimum 8 weeks, moderate or vigorous. Aerobic exercise, resistance exercise to improve your muscle strength. Combined can be done, aerobic and resistance. Then frequency is 3 to 5 times in a week over the years, not few days. It should be continued for years. It will lead to healthy person. Mediterranean diet, you can see the pyramid. The base of the pyramid shows that whatever available season foods you should take, the local food you should take, and the maximum part, your body is 90% water. Consume water more. And what you have to consume least is the gluten-free sweets, packed foods. So the maximum you should consume is the 90% water. In Indian diet, we are rich with the fruits, vegetables you should consume in every meal. Then in every day, you should take care of your exercise daily, cereals, millets, superfoods, oats, pulses, red meat can be taken, processed meat can be taken, but on the week basis. And last is the packed items. You can see the chart and the bowl, you can see the plate. It is a colorful plate. In the same way, your plate should be colorful with all the 7 colors of the rainbow. You can remember, consume, what you have to consume is 5F. Foods, which includes your fruits, vegetables, apples contain pectin, they are anti-aging. Then berries, spices and herbs are rich in Indian traditional diet. We use haldi, turmeric, haldi milk, and that is very good, antioxidant, anti-inflammatory. Then we can consume green tea, coffee, whole foods, millets we have said, kala chana we can take, it's a good source of protein. Then second F is fish, rich in omega-3 fatty acids. Even the seeds are rich in omega-3 fatty acids. Fiber, chia and flax seeds contain fiber, good fiber. Then fourth is the fermented foods. They are rich in probiotics, curd, lassi. In Indian diet, we can say, what we can say, dairy products, fermented South Indian food, kanji we make. It is all good source of probiotics. And good fat. Olive oil, which is rich in MUFA and PUFA, monounsaturated fatty acids, polyunsaturated fatty acids. Then nuts and seeds can be taken in a good amount, especially walnuts is good for brain, almonds is good for heart. What you should avoid is avoid the processed foods, meat, high saturated fats, refined carbs, fruit juices, potatoes, all O's, potatoes, fructose, and refined sugars, dairy, and gluten. All these red things you can see cause leaky gut. So you can avoid this for the gut health. Then time restricted eating is better than the intermittent fasting. Dietary fibers should be taken. There are different dietary fibers in different plants and fruits, vegetables, whole grains, nuts, and legumes. You have to consume all to get the benefit of all. Then lifestyle changes. Simple words, prebiotics and probiotics. A probiotic is what? Live bacteria. That is found in the curd, yogurt. It improves digestion in the fermented foods. You can have this thing. Even the cheese, old cheese, they are probiotic supplements. Yakult is also one thing. Then prebiotics. What is a prebiotic? Is a fuel for probiotic, for the live bacteria. And that can be all the green vegetables, fruits, bananas, whole grains, and fiber-rich fruits. There is a simple principle, 5R principle, to set your gut health. First R is to remove the food that is problematic to you, that is inflammatory, like avoid food that is alcohol, carbonated foods, caffeine, dairy products, baked goods. Replace it. Second R is replace it with the nourished foods. Select healthy diet, bone broth, coconut products, sprouts, fermented vegetables. And third R is to reinculcate it with probiotic supplements like curd, lassi, kimchi, kanji, whatever you say, idli, those are South Indian foods, whatever you consume in the Indian diet is very rich in probiotics. Fourth R is repair the gut lining with the therapeutic foods and nutrients. Fifth R is rebalance your lifestyle. Lifestyle correction should be there to reduce gut damaging habits. Sleep in time, eat in time, that is important. So 5 R's is very important. Next will be lifestyle changes, how to build a healthy microbiome. You can again remember a simple formula of the new start. N for nutrition. Consume 5F, fruits, vegetables, fiber, fish, fermented foods, good fats. Avoid processed, refined, O's, fructose, sucrose, and potatoes. Avoid dairy and gluten. Then third is the mindful eating. Whatever you eat, concentrate on what you eat. Chew properly. Don't use the mobile, just concentrate and enjoy what you're eating. Gut-friendly cooking. If you are fermenting your foods, soak your pulses or rice in the night and then cook in the morning. That gives more. Even the millet should soak in the night and cook in the morning. That is more healthy. So gut-friendly cooking is advisable. Then TRE is time-restricted eating. You should not eat all the time. Or fasting should not be long, but you should eat with the timings, time-restricted eating. Second E is E. Exercise for 45 minutes, 4 to 5 times in a week, and continuous for many years. Third is the weight control. W is for weight control and the water. Water should be optimal. If you're not drinking proper water, you will be dehydrated and your gut system will not function properly. So S is for the sleep, for the sunlight, adequate sleep of 8 hours in a day, refreshing sleep. Sunlight helps for the depression, it enlightens your mood. Then S is for the stress management. T is for temper, anger management. A is for avoid alcohol, tobacco, smoking, stress, antibiotics, painkillers, and the sedentary lifestyle. Walk as much as you can walk. 10,000 steps or more, whatever you do, just keep on walking, running, whatever you do. You'll be active in that way. And R is for to relax. Regular checkups can be done, routine, follow a dincharya. And T is to take care of your body and the personal hygiene. See, in the lifestyle medicine, you can remember with the 3S, stress management, social support, and sleep. Then comes the nutrition, exercise, and avoid the risky behaviors. Now, what is a bridge? How can we use the science and art? We'll discuss with the practical steps and the case studies. In the simple words, what science says about the diet? It should be high fiber, plant-based, and the probiotic rich. And how to use it artistically is listen to the cravings and eat seasonal food. Cook properly. What science says about the stress? It says stress, cortisol disrupts the gut flora. And what art does, how can you reduce the cortisol or the stress? How can you do it? Artistically, it's through journaling, meditation, and the nature walks. You will feel better when you walk in the nature. You will feel fresh. What science says about the sleep? It should be 8 hours and it regulates microbial diversity. If it is not properly done, how to make it proper? Artistically, you can create a calming bedtime ritual, sleep in the same time, same place, darken the room. Don't use the mobile few hours before the sleep. Small hygiene, sleep hygiene is important. You'll feel better. This is the artistic thing, bedtime rituals. And what about the supplements? What science says about the supplements? The probiotics, prebiotics, digestive enzymes. It will help you for the gut health. But what you can do artistically, whatever you do, start small, adjust based on your response. Don't take in majority. What even the supplements, if you take, start small dose, but try to improve your lifestyle. Then the case studies. In short, we can say we can see the 5 case studies. The anxious person. In the anxious person, the science says there is a HP axis dysregulation, hypothalamus, pituitary, adrenal axis dysregulation. In the anxious person, the cortisol rises, stress rises. What should we do? Artistically, we should do the mindful eating. Whatever you are eating, concentrate on that and don't use the mobile or talk to somebody that time. Just concentrate on the eating. Chew properly and taste properly. Fermented foods are easily digestible and it will cause less bloating and calmer mood. Then what about the foodie? Second case, the foodie person in the science says a foodie will eat more. It will cause the inflammation from the processed food, chips, junk food. How can you correct it artistically? So the balanced eating, use of spices and herbs, and it will improve the digestion. Third case is the post-antibiotic microbiota depletion. Artistically, we can correct it with the broth, prebiotics and probiotics. It will restore the gut flora. Child with the eczema. In this, immune gut axis is disturbed. And what is the solution? Elimination diet. Whatever causes the eczema, eliminate it from the diet. Outdoor play with the nature, it helps in reducing the allergies. It will lead to fewer skin issues and increasing your immunity. Sixth case, first, second, third, fourth, fifth. Fifth case is the jet lagger. Science says there is a circadian disruption because he's not sleeping in the right time because of the flight disruption. So what is the solution artistically? Lemon water, magnesium and probiotics. It will improve the motility and sleep. Then what are the emerging trends? We can manage chronic diseases with the using the knowledge of science, practical approach of art, FMT, fecal, manual transplantation, balancing gut microbiome, good and bad bacteria, gut microbiome testing can be done, microbiome enhancing lifestyle changes can be done, evidence-based integrating scientific research and practical applications can be done, precision medicine, tailoring diets, individualized approach. In this way, we can manage chronic diseases. There are many challenges and opportunities, like there is a complexity of gut health, individual variability, lifestyle factors. And next will be the homeopathy and gut health. Homeopathy system is a scientific system. Homeopathic treatment is a scientific system of medicine. It uses the scientific knowledge of medicine, practical approach of art. There are two principles, holistic individualization and holistic approach. It helps in restoring gut health, leading to treating underlying the root cause of the gut imbalance, promoting long-term healing. It is very effective and cost-effective, safe, no side effects, selects right medicine on the totality of selects the right medicine on basis of totality of the symptoms and not just diagnose the name of the disease. It includes proper history taking, physical examination, investigation, signs and symptoms are taken, gives more importance to the mental symptoms, underlying stress, emotions, ailments from grief, etc. And disclaimer, consult with your doctor for it. There are few medicines that I'm naming, but you cannot use it yourself. You have to talk to the doctor. Some medicines for gut health like Nux vomica, arsenic, carboveg, lyco, calcareca, natrum, bowel nosodes. You can talk to your doctor in detail. Then the 10 roles of homeopathy in restoring gut balance. Just 10 points you should remember is it promotes your digestion and alleviates gas. Alleviates is the improves your gastric problem. Second, relieves the constipation. Third, calms the inflammation in the gut. So it reduces the inflammation, improves your immune function, reduces acidity, acid reflux. Six, it supports the liver and gallbladder function. It improves it. And seventh, it relieves the stress-related digestive problems. Since we are discussing everything, the mind part is important in homeopathy. Eight, it treats food sensitivities. We are dealing with the allergies, milk allergy, peanut allergy, everything. And it reduces abdominal cramps. And lastly, it improves the gut flora. Summarizing in 11 points, prevention is better than the cure. It's for all the health. It may be gut health, memory, mental health, brain health. Prevention is the first and foremost thing we have to do. Second, the purpose is to create awareness, educate, and empower people, leading to the healthy life. Third is we started with the all health starts in the gut. Gut is the most important doorway to the health. Fourth, as the father of medicine, Hippocrates has rightly said, all diseases begin in the gut. Fifth, gut health is everyday investment for life, not for 1 day or 2 day. It is everyday life investment for life. A healthy gut leads to better digestion and more energy. Sixth, gut is a fertile soil. Whatever you will sow in it, it will come out. Nurture it. Give it natural food, environment. What we eat, we become. We are what we eat. Important message of today is what you eat, when you eat, what quantity you eat. Consume gut-friendly foods, fermented foods, hygienic foods, healthy foods, home food, freshly cooked food. Millets, green vegetables, naturally grown seasonal foods, and freshly cooked. Avoid inflammatory foods, wheat. In some people, wheat allergy is there, gluten allergy is there. Corn is the inflammatory, soya is inflammatory, sugar is inflammatory, milk is inflammatory. Avoid all these. Refined, packed, preserved, and fast food should be avoided. Seventh is reduce calorie intake. Increase your physical exercise, reduce weight. And you can remember the formulas. Eighth formulas are DIM, digestion, immunity, and metabolic function in the moods. 5R principle is remove, replace, reinculculate with the probiotics, repair and rebalance your lifestyle. New start is the nutrition, exercise, water, weight, sleep, temper, avoid, and take care of your body and proper hygiene. 5F we have done. Then role of homeopathy is ninth, is proven to be very effective in restoring the gut health. Seek professional help whenever needed. Keep yourself updated with the knowledge from the reliable resources. 11th and the last point is more research and documentation is needed. Collaboration between the homeopathic practitioners and mainstream professionals, health professionals should be promoted in the upcoming years. Thank you. And the last message, and the most important message, the secret to the living well and longer is for the gut health, for every health is to eat half, walk double, and laugh triple, and love without mere. Thank you for your patience, hearing, and listening. Thank you so much. You can note down my Gmail, and whenever you need, you can talk to me. And any questions, you are most welcome. I have completed my presentation. Any questions, you are welcome.
Dr. Shweta, please unmute yourself and call him. 1 plus. Dr. Shweta, can you hear me?
Yes, doctor.
Please call him. 1 plus 1, 13, or I don't know. He want to talk, but he is not unmuting.
Yes, doctor. Now I can unmute my mic.
Okay.
Okay.
Call
Thank you,
him.
Dr. Poonam.
Thank you.
The session was really very nice and it was very informative, and you explained each and everything very patiently. And the session is really informative and it was very nice. Thank you, doctor, for
I
your
would like to
wonderful.
add some points. Can I add it?
Yes, doctor. Yes.
The hydration part is very important. Nowadays, people are not drinking a lot of water. They can add the lemon water in their diet, soap water, ajwain water. It is good for the digestion. And in the Indian diet, it's not only Mediterranean. In the Indian diet, it's a very rich diet. It's rich of fruits, vegetables, all colorful, and we are cooking it fresh in Indian diet with all the spices, the haldi, turmeric, ginger, onion, garlic, everything is very nutritious and anti-inflammatory. So if you are not following the Mediterranean, our Indian diet is having a good culture, rich in fermented foods and rich in everything. We should eat it with a pride. And some fruits, there is one fruit called superfood. Bale is very good for your stomach. It helps to keep your gut health better. Then the kimchi is there. Kanji, in olden times, we used to make it from the black carrot. And then there is a rice kanji also. There are a lot of recipes and lot of things. And right now, everything, if you are dealing with the gut health, you can cure lot of NCDs, non-communicable diseases and metabolic diseases. For example, we can treat, we can heal in a better way. We can control the metabolic diseases like diabetes, blood pressure, high triglycerides, heart diseases, and the obesity. Whatever all these NCDs are creating a havoc in the future times. So we have to be treating the gut health and treat all these things. We have to make people aware of what they are eating, what they are sleeping, what they are drinking. They should know about their health and take care of their health so that they can stop the expenses in the future in the medical thing. Instead of treating the disease, take the prevention part and don't let the disease happen. Thank you.
Yes, ma'am. Ma'am, there is a question in chat box. Dr. Anuj Kumar is asking, what about milk in gut health? What about the
Milk,
role of milk in?
milk you can consume, but in the form of the curd, if it is a better form, it is because it is fermented. And if you want to add something to probiotics, Yakult is available with the probiotic thing. You can add something that makes it probiotic. You can take in the form of curd. In milk, allergies is very common nowadays in children because the milk is not pure like it used to be earlier. If it suits you, you can take it.
I think that Dr. Ramprasad,
Thank
you
you,
can
Dr.
answer.
Robert De Silva and Dr. R. Sweta, and congratulations, Madam Dr. Poonam Chablani. Very nice. Describe the function of gut microbiota. Gut is the role of, and gut is a second brain. Gut is a second brain.
Yes, sir.
The important role of the health. हिंदी में कहावत है, पेट साफ तो बीमारी माफ।
बिल्कुल सर, बिल्कुल।
पेट ही से बीमारी होता है। ओशो का एक थ्योरी है कि माँ का जब से बच्चा पेट में रहता है तो माँ जो है, माँ का खून चूसता है ना। तो गट के लिए बहुत अच्छा, वेरी नाइस प्रेजेंटेशन, एंड डाइजेस्टिव इम्यूनिटी एंड मेटाबॉलिज्म एंड 5F, very important diet. 5F, fruit and fiber, fish and fermented food and good fat. So very important diet and lifestyle. Exercise the very important. Exercise and lifestyle the very important, and healthy gut and healthy microbiota produce. तो very thanks. and एक कहावत है हिंदी में, नित दिन खाए ताजा सीजन फल फूल और कंदमूला, शरीर बन जाए, शरीर हो जाए चंगा, और बन जाए मन, और बन जाए हो जाए गुणशीला। So, thank you. Thank you.
Thank you, sir. Thank you so much for your kind words.
Madam, it was a very nice
Poonam,
presentation.
Any questions?
Yeah, I want to
Shall I
ask
ask you a
you,
question?
Madam, what to do to get the inflammatory conditions if there is bowel inflammations that time, which are the medicines or the tissue remedies we can use?
Sir, medicines you want to know about the homeopathic part?
Yeah.
We will not discuss the medicine because it's a public platform. This is part, I am giving the awareness part. I will not discuss the names of the medicine. I've just given the basic names. I've given 5R formula. Whatever doesn't suit you, you should follow the 5R. Even for the inflammation also, it will reduce the inflammation. And this 5R formula takes for 3 months. You have to replace the foods that, you have to avoid foods that are anti-inflammatory first thing. Replace them with the healthy foods. Add healthy foods. Third, with the probiotics that will reduce the inflammation. Fourth, you have to take care of your health, reassert whatever the lifestyle and everything. And fifth will be the lifestyle management. All the 5R is important. That has to be done for a few months, minimum 3 months. If you take care of it, your inflammation in the gut will reduce. The gut inflammatory diseases will also become better.
What are the substances, alkaline substance, which can increase the blood?
Alkaline water.
Yeah.
We are saying alkaline water, nibbu pani, ajwain pani, hing pani, and you can have the fermented foods, idli, dosa, South Indian foods, even the dokla, whatever you ferment, the good bacteria grows in it, it helps in the anti-inflammation. Then your fruits, everything is good in antioxidants, anti-inflammatory. You can use onion in the diet. It is prebiotic. Garlic, we are using in the house also. It's a prebiotic. Onion, garlic, ginger, anti-inflammatory and antibiotic are there. You can have the green tea. That is also anti-inflammatory. You can have the chia seeds, flax seeds, but soak it and then have it. So all the diet part that I have discussed with you, we will be antioxidant, anti-inflammatory, and anti-inflammatory.
What about lemon?
Lemon water is good, but in some cases, in some people, it doesn't suit, but otherwise it is a good thing. If you can have the jeera water. In maximum cases, it suits, but in few people, if it doesn't suit, you can change with some other water. Even the ginger reduces the gas. It reduces the bloating. It is good for digestion. Adrak, what was it? Haldi, what we use in the spices. Tulsi tea, tulsi chai. Cardamom, all the spices that we use in the Indian kitchen, in our households, is very good and anti-inflammatory. Is good for, but the thing is that whatever you eat should be in the proper time, not at late at night. The timings should be there, quantity should be less, and whatever you eat, exercise more. And
Thank you, madam.
you can have more of the salad.
Madam, according to law of homeopathic science, invisible anger, main role of anger, unhealthy bacteria. Anger and emotional cause of emotional.
Yes.
The anger is the very important. Digestive system stop, hormonal disturb. So anger is a very important. Okay.
Yes, sir. The New Start formula is very well, sir. If we follow it, we cannot go wrong.
That is why you are always laughing, sir.
Laughing is the best exercise. Laughing is the best exercise. All hormones secret.
You
Always
use less
happy
muscles in
person.
laughing than in
Yeah, he's
frowning.
always happy person.
Dr. Poonam,
Yes, ma'am.
Doctor, can you tell me about coconut milk in gut health?
Yeah, in South India, coconut milk is, you are using it more, and it is very hygienic. Even if the child is not able to take the regular milk, there is milk allergy or some, coconut milk can be given. It is very nutritive, and I think you know more about it because you are in South India, and you can elaborate it more. You can add your points if you know more about it.
Actually, patient of ulcer,
Yes.
in gastric ulcer cases, we will advise the patient to take coconut milk in early morning in empty stomach or in evening. We advise them to take.
Mhm.
Actually, it is the best medicine for ulcer. It is giving results also.
Thank you. Thank you for sharing it. This is a good learning platform. It's not, I am
Yes,
giving the
doctor.
lecture, I am learning from all of you also.
What about aloe
Thank
vera? Aloe vera.
Aloe vera is also good antioxidant, sir.
Mhm.
But it should be not the garden. It should not be from the garden. It should be properly refined. You can take it if it is guaranteed, properly made it, then you can take it. Otherwise, not from the garden, it can be the poisonous thing also.
Ma'am, some patients are saying they are using the plain aloe vera pulp then. They are mixing that aloe vera pulp with buttermilk or with water. They are grinding and drinking the juice. Whether that is advisable?
No, no. In the fresh aloe vera from the garden, it can be the poisonous species also. It is always recommended to take it from the chemist or the reasonable source where it is a properly in the container and with a guarantee that it is a pure thing. You can use that pure bottle. And because if you use the poison, it can react with your skin, it can react with your system, and it can cause allergies and inflammatory thing. I have heard a lot of cases about this. The juices, the fruit juices or the aloe vera juice also, if they are drinking the poisonous species, it can be fatal also. So you have to take a caution.
Okay.
There are many varieties, so it should not be the poisonous one. And you don't know how to test it.
Yes. Okay. Thank you, doctor.
Thank you
Uh,
so much.
Thank you. Thank you so much.
Thank you for giving me
Sir,
this
shall we
opportunity.
wind up the session, sir?
Okay. You can do.
Thank you, ma'am, for your question and for your valuable time. Thank you so much, and thank you all the doctors for participating in this session. Thank you, and I'm handing over the session to the next session moderator.
Thank you for patient listening. Thank you.
Thank you, ma'am. Thank you.
Thank you, ma'am. Now we can pass to Dr. Mariama John for Malayalam session.
Yes, doctor.
Thank you all. Thank you all. Thank you,
Thank
Dr. Sheda, for moderating all the Mariama doctor, സംസാരിച്ചോ?
Dr.
ഒരു
Mariam.
മിനിറ്റ്